Hello, today I would like to share with you my clinical experience treating hyperthyroidism. In acupuncture theory, the root cause of hyperthyroidism is liver fire. The liver organ belongs to the wood phase. Liver fire is essentially the burning of the wood phase. All other symptoms that we may encounter are branched out from this main cause. The symptoms of inflammation, increased heartbeat, redness, irritation are classified as fire. Heat rises up and the body uses fluids to cool it off. Perspiration is one of the visible manifestations of this mechanism. Internally, the rising heat is stopped at the throat. Fluids obstruct further ascension of heat, and heat obstructs the circulation of fluids. Fluids dry up and become phlegm nodules. A combination of intense heat and phlegm may progress into fire toxin. That's when the nodules in the neck become engorged and sore. The liver opens into the eyes. When the heat rises, it can cause bulging, redness, dryness, or tearing of the eyes, commonly known as Graves' ophthalmology. Liver fire creates the internal wind that manifests as tremor. Excessive wood phase transfers the energy into the fire phase. Heat in the pericardium channel, the zone associated with the fire, causes rapid heartbeat, palpitations, anxiety, and restless sleep. Liver wood over-controls spleen earth, causing loose stools and lack of energy. Wood drains water, resulting in empty fire or yin deficiency symptoms, such as dry mouth, restless sleep, and 5-palm heat. Fire can burn up qi, blood, and yin, causing lassitude and weakness. Now, let us speak about the treatment strategy. At the root of the disorder lies a wood-centered disharmony that may branch out into other channels. Therefore, our primary strategy is to harmonize the wood phase. We know that the fire phase drains the wood phase, and the metal phase controls the wood phase. Let's see if the Bagua analysis would support this approach. Let us take the hexagram that represents the liver channel. This is Kuhn hexagram. It is comprised of double Kuhn trigrams. Kuhn is classified as yin-earth trigram. When a hexagram is used to represent energetics of a yin channel, the initial lower yao belongs to the wood phase, the second yao belongs to the fire phase, the third to the earth, fourth to the metal, fifth yao belongs to the wood phase again because it is represented by the lower point, and the final yao belongs to the water phase. If we are to change the polarities of the second and fourth yao, because they belong to the fire and metal phases respectively, the new hexagram is going to be Jia. This is a hexagram number 40. Jia hexagram has the Kan, yang water trigram on the bottom, and Zheng, yang wood trigram on top. Water nourishes wood. This is a harmonious therapeutic model that may be applied for the treatment of liver fire. We can choose metal and fire points as our basic treatment strategy. Next, let's review different possibilities for point selection. In addition to the metal and fire point selection, we need to examine channel trajectories that traverse the neck region where the thyroid gland is located. The liver channel ascends along the neck and the throat to the tissues surrounding the eyes, but it does not have any external pathway. Additionally, the stomach and Ren channels pass this region. In terms of the choice of acupuncture points, we can choose points located directly on the liver, stomach, and Ren channels, or we can choose points on other channels that balance these channels. The local points on the stomach channel are stomach 9 and stomach 10. They are found exactly at the site of the thyroid gland. Ren 22 and Ren 23 are located above and below this area. Squeezing a few drops of blood from the area of stomach 9 is a very effective method to clear inflammation from the thyroid gland. This is done especially in the initial stages of the treatment, when the gland is engorged and there are red capillaries on the neck. You want to bleed those capillaries if possible. Stomach 45 and stomach 41 belong to the metal and fire phases, respectively. Both of these points treat inflammation in the throat region. In addition, stomach 41 has a holographic correspondence to the neck region, and stomach 45 has a holographic correspondence to the eyes. Stomach channel has the following connections. Foot Yang-Ming stomach channel is connected to the hand Yang-Ming large intestine channel. These two channels are a Yang-Ming pair. On the large intestine channel, we can choose large intestine 1 and large intestine 5 points. Large intestine 1 is a Jing well and a metal point, so it would be especially effective in the initial stages of the disorder. You can bleed it to clear heat. This point clears stagnant qi and blood, removes constraint, and unblocks orifices. This point also has a special effect on the throat. Large intestine 5 is a Jing river and a fire point. Because of its connection with the lung channel, it can regulate perspiration. As a fire point located on the wrist, this point has both 5-phase and holographic characteristics to treat inflammation in the neck region. Another important combination of points on the large intestine channel is large intestine 13 and large intestine 14. These 2 points break up neck nodules. You can add Sanjiao 10, another major point, to transform phlegm and break up nodules. Foot Yang-Ming stomach and hand Jiayin pericardium channels are connected as the extraordinary pair. Pericardium channel protects the heart. Its use becomes essential in treatment of exuberant fire, especially when it is causing irritability and insomnia. Pericardium 8 is a very special point because it is a fire point on the fire channel. It is excellent at draining heat and fire, as well as draining damp heat. It treats palpitations with insomnia and vexation. Pericardium 5 is a Jing river and a metal point. It dredges pathogenic qi from the Jiayin channel, so it is a great choice to treat liver fire. Jing points are related to sound production, so this point has a special connection with the throat region. Because of its metal phase association, pericardium 5 is connected to the lung channel and can regulate sweat. Foot Yang-Ming stomach and Foot Tai-Yin spleen channels are connected as a yin-yang pair. Spleen channel produces qi and regulates digestion. This channel becomes very important when the patient is experiencing low energy and has loose stools. Spleen 2 is a yin spring and a fire point on the earth channel. Fire is a mother point on the earth channel, so it is an essential point to treat deficiency of qi. As a fire point, it drains and expels pathogenic heat. Its holographic correspondence with the neck region makes it an important point to deal with thyroid dysfunction. Spleen 5 is a Jing river and a metal point on the stomach channel. In addition to this point's holographic association with the neck region, it treats abdominal fullness and loose stools. Next, I would like to discuss the liver Foot Jiayin channel. Liver 2 is a yin spring and a fire point. As a fire point, this is a child point on the liver channel. Liver 2 is the main point to drain the liver channel for excess patterns. It clears and drains fire and extinguishes wind. It has a desired holographic correspondence to the neck area too. Liver 4 is a Jing river and a metal point. It is another important point to treat liver channel, and it also possesses holographic correspondence with the neck. I like to needle this point through and through to reach stomach 41. Not only this combination opens the front of the neck region, but this technique helps to release muscular tension in the back of the neck and shoulder on the opposite side. Now we can discuss liver channel associations. Foot Juyin liver channel is connected with Foot Shaoyang gallbladder channel as a yin-yang pair. The gallbladder channel is essential in treating hyperthyroidism. As a yang outlet of the liver channel, the gallbladder channel will take on and try to manage the excessive yang energy that is produced in the liver channel. It is a unique channel also because of its connection to the extraordinary channels. As for the 5 phase points, gallbladder 44 is a Jing well and a metal point. It has the capacity to treat diseases of the qi deficiency and stagnation. It also has a strong calming effect and can treat sleep irregularities. It is a very effective point to treat eye disorders. Gallbladder 38 is a Jing river and a fire point. It treats throat conditions. Wood disharmony causes wind symptoms, such as tremor. Gallbladder 31 and gallbladder 20 are 2 major points on the gallbladder channel to deal with wind symptoms. Master Dong acupuncture points called 3 weights 77.05, 77.06, and 77.07, the first, second, and third weights respectively. They are part of the gallbladder channel. Specifically, the second and third weights are gallbladder 37 and gallbladder 36 points respectively. This triad of points has a special effect on thyroiditis. Foot Juyin liver channel is connected with Hand Tai-Yin small intestine channel as a midday pair. Small intestine 1 is a Jing well and a metal point. It can treat eye and throat disorders. It can be needled or bled. Small intestine 5 is a Jing river and a fire point on the fire channel. This is another true fire point. We have discussed the pericardium 8 point already. It is especially an effective point for treating fire and heat disorders. Its location on the wrist gives it access to the throat region. Now we can talk about the extraordinary channel connections. Ren is an extraordinary vessel, so it does not have transport points with the 5 phase affinities. In terms of the holographic correspondence to the neck region, we can look for tender points in the region of Ren 11 through Ren 13 and Ren 6 through Ren 4. However, there are other extraordinary channels that access Ren channel at the region of the throat as well. Let's take a look at Yin-Wei linking vessel. It takes points from the liver channel and accesses the throat at Ren 23. Liver 13 is part of the Yin-Wei linking vessel's trajectory. This is a major point to treat thyroid issues. Yang-Wei linking vessel is a yin-yang pair of the Yin-Wei linking vessel. An interesting observation can be made regarding the gallbladder and small intestine channels, both of which balance the liver channel. These channels also lend points to the trajectory of the Yang-Wei linking channel. This channel is said to strengthen the communication of all yang channels, and we should expect it to have very good heat-clearing properties. Gallbladder 21 is a meeting point of the gallbladder and Yang-Wei linking vessel. One of its actions is to transform phlegm and dissipate nodules. Another point on the trajectory of the Yang-Wei linking channel is small intestine 10. In Master Dong acupuncture system, this point is called DT 0.01, the upper separation branch. This point is bled to clear fire toxin. I find it an invaluable point to treat any sort of acute or subacute inflammation in the body. It is said to treat any kind of poisoning, including radioactive, so it would be an invaluable point to clear fire toxin stage of the disorder. Another aspect of treating hyperthyroidism is dealing with the deficiencies that resulted from the hyperactive liver fire. Fire burns yin. Yin is dominated by the kidney channel. Kidney 2 is a fire point on the water channel. It drains kidney fire. Combine it with spleen 6 for stronger effects. Kidney 2 also treats spontaneous sweating. In case of Qi deficiency, we like to choose spleen 6 and Ren 6. We have discussed a great many points. Does it mean we have to needle them all at once? Absolutely no. In my treatment protocols, I try not to exceed 10 needles. Try to address the root of the treatment and the branch and add 1 or 2 points to address the underlying deficiency. One simple guideline that may help you to choose the right point combination is to look for the floating and rapid pulses. The pulse that flares up the most represents the channel that is most likely taking on the excessive pathogenic qi from the liver channel at the present moment. You can needle a fire point if the pulse is rapid, or a metal point if the pulse is tight. Most importantly, don't think of acupuncture as a one-shot deal that will restore the problem. Develop a treatment plan and treat your patients at least twice a week. This is how acupuncture works. Monitor your patient's TSH to T4 levels. Once you see an increase in TSH production, you will know that your treatment is working well. I hope you enjoyed this presentation. If you would like to see more videos like this, please press the like button and subscribe to my channel.